from one of the researchers and also director at the SA Medical Research Council, Dr. Farid Abdullah. He is director of the AIDS and TB Research Unit at Steve Biko Academic Hospital in Pretoria. Doc, thanks so much for your time. So the study that you were a part of, it looked at over 450 patients who got Omicron. What did you find?
Well, we did a few things, Sally. Thank you for having me. And just to point out that I'm not a professor, but merely a doctor. We found that the number of deaths amongst the patients infected by the Omicron wave was significantly lower than previous waves. The ICU admissions were much lower. And notably, the length of hospital stay was about 50% less. So just to repeat that, we looked at 466 patients admitted to the Steve Biko Hospital during the Omicron wave and compared that to all the patients, 4,000 patients in the previous waves.
So can we emphatically say that it is proven, and my apologies for calling you Prof, not Doc, can we say that emphatically we've proven that these better results are not due to younger patients being admitted, vaccinated patients being admitted, or people with previous immunity from natural infections?
On the contrary, it's exactly those factors which has led to the lower severity. And Professor Shabir Madhi's seminal work on seroprevalence in Gauteng is, the best explanation for why we're seeing this lower severity. So that's exactly the reason. But there's more and more evidence now that there's also an intrinsic change causing less virulence in this virus. So the Omicron variant is looking more and more like it's less pathogenic, less virulent. But the main driver and our theory at the moment is that it's people who have had prior infection, vaccinations, and a younger profile that's leading to this less severity of disease as seen in the hospitals in Gauteng.
All right, so what I'm hearing you saying, and just correct me if I'm wrong, is that actually it's a combination. It's the fact that many more South Africans are vaccinated compared to the first time round. A lot of people have got immunity anyway, and also younger patients were impacted and they have a better chance of fighting off the disease. But also, this variant, in terms of its makeup, is less severe. Am I right?
Yes, the evidence is not complete on the lower virulence, but there are definitely some studies now showing that it might infect the upper respiratory tract more effectively than the lower respiratory tract, that the symptom profile is different. But the overall picture that's emerging, and whatever the mechanism to get to it, is that there are fewer deaths, fewer ICU admissions, and a shorter length of stay. Now, just to quickly point out, when I say fewer deaths, I mean the death rate in the Omicron wave was 20% of what we saw before. The ICU admission rate was 75% lower, and the hospital length of stay went from an average of 8.8 days per patient to 4 days. So in the end, these are the measures of lesser severity. So there must be something going on with the virus too.
Yeah. Are you able to say if there were any deaths from Omicron? My understanding is that in South Africa it's difficult. We don't actually do that testing to see which variant led to a person's demise, whether it was Delta or Omicron.
Yeah, so in the Tshwane area, in the Pretoria area where we did the study, the genomics people have shown that Omicron is absolutely dominant here. 98 to 99% of all cases are now Omicron. So we don't have too much doubt in our minds that what we're seeing here is due to Omicron. And so I'm glad you asked that question, because about 10% of our patients in a snapshot survey done at the peak of this wave had severe disease. So it would be misleading to say that you can't get severe disease from the Omicron variant. What we're saying is that the proportion of people getting this severe disease is a lot lower than it was in previous waves. In addition to that, and to answer your question, Sally, we had 21 deaths during this wave, and we did a detailed cause of death analysis, and 14 of those 21 patients died from COVID-related pneumonia due to Omicron.
Right. So with these encouraging results that we're seeing less time in hospital, less people in hospital, lower deaths from Omicron, would this be putting it into the category of a sort of normal flu and the impact that a normal flu might have? And could this signal that the worst of the pandemic is over? And of course, I'm referencing my chat that I've just had with Dr. Aslam Dasu, and he said he believes this is going to be a game-changer year for the pandemic.
Yes, so looking at the data from the hospital, and we then in our study compared it to the data from all hospitals in the Pretoria area, and we went further and compared the rates, meaning the case rates and the death rates in Gauteng, and it showed this incredible decoupling of deaths and cases. So many, many more cases, and about 90% reduction in deaths. Those are the early signs that we're entering what we call the endemic phase, which means that most people in the country, in the globe perhaps, have some sort of immunity from prior infection and or vaccination, and that this is having a protective effect on the majority, which means that we'll see a shift of the severe cases to people who are immune compromised. And it's just a completely different way of looking at it. Now, to answer your question, which is quite a difficult question, is this the same scenario as we see with influenza? I think it's a bit of a stretch to make that the case. I think we'll still see more deaths and severe disease from COVID-19 than we have from influenza. But I think influenza is being used as an example of where we might end up. Having said that, we think that the evidence from Gauteng, certainly, from the hospital in Pretoria, is a harbinger of what might happen in the rest of the country and in the rest of the globe. So just to complete that point, we're seeing a similar picture come out of the Western Cape now, lesser severity of disease, and we're starting to see reports from the UK and the US, some cities in the US, of a similar picture. So it could very well be the kind of end of the epidemic phase as we know it, and the ushering in of the endemic phase.
Absolutely fascinating and potentially very encouraging. Thank you so much for telling us all about it. The researcher, one of the researchers at the Steve Biko Hospital's Omicron study, and a director at the SA Medical Research Council, Dr. Farid Abdullah. Thank you so much for your time.